As a new nurse or nursing student, do you struggle to set priorities and recognize which patient you should see first with multiple patients? If so, you're not alone. Priority setting by recognizing what clinical data is relevant, then interpreting the meaning of that data to determine the correct priority is essential to clinical reasoning that leads to the outcome of a correct clinical judgment. And like any other skill in nursing education, it requires repetition and practice to develop. Now, as a nurse in practice, you're going to have multiple patients in the clinical setting in a wide variety of settings. To be safe in practice and pass the NCLEX, you must be able to answer this very important question. Who does the nurse see first? Now, practical priority setting in the clinical reality in that realm is looking at a number of about 4 different variables that I really want to empower you to develop. Number 1, the age of the patient. If you have multiple patients and you have an older adult over the age of 65, the older patient is always at a higher risk to develop a complication, or at least a greater risk. Therefore, they should be seen first. When was this patient admitted? Remember that the more recent the admission, the more likely that patient is to be unstable. Therefore, when all things are equal, see the patient who was admitted or who had surgery most recently. Another variable, how many body systems are impacted by the patient's current problem or past medical history? If all things are equal, if a patient has chronic renal failure or diabetes, these impact multiple body systems, and therefore this patient should be seen first. Now, I'm excited to share a simple clinical reasoning activity that I developed in coordination with another gifted educator, Lindsay Lambrecht, here in Minneapolis, that will provide you with a practice of this essential clinical reasoning skill of priority setting. You can use this priority patient activity to simulate the practical priority setting that a nurse will experience in practice. And you can use this as an individual student activity if you're a student or new nurse, or as an educator, use it as a virtual clinical activity or enhancement of your traditional clinical as a vibrant post-conference discussion starter. Now, there are 3 acute patients in this priority setting activity in an acute care setting in the medical setting at a metropolitan hospital. Patient number 1 is Herbie Sanders. He's 62 years old with heart failure exacerbation. Patient number 2, a 71-year-old male with a recent below-the-knee amputation. And patient number 3, Gladys Parker, a 92-year-old woman with weakness and falls. Part 1 of this activity unfolds in 3 parts. Part 1 begins with nurse-to-nurse report, a review of the chart and priority setting by recognizing what clinical data is relevant and its interpretation of why it's significant. This, again, is an essential clinical reasoning skill, essential for safe nursing practice, as well as passing the NCLEX and the upcoming next generation NCLEX. And this part 1 is currently available on keithrn.com and can be accessed using the link in this video. Part 2 unfolds in the next section of the Unfolding Clinical Day, where now you collect the first set of vital signs, nursing assessments. You need to communicate to the physician or primary care provider an SBAR. All of these skills are practiced. In part 3 are new orders, evaluation of the patient's problem, and problem recognition and student reflection. And parts 2 and 3 are available inside the all-inclusive access membership specifically for nurse educators. So if you're looking to learn more about this essential resource that can help develop the practical priority setting with your students, be sure to check out the link on this video to learn more and use this activity to prepare your students not only for the NCLEX, but more importantly, real-world clinical practice and the priority setting required by the professional nurse.